Assalamu alaikum. In this video we are going to discuss about angiotensin converting enzyme inhibitors, a very important class in the pharmacology of cardiovascular system or cardiovascular pharmacology. So they are commonly known as ACE inhibitors. Okay, so the normal physiology or the normal process in the body takes place something like this. Consider this flow chart which I'm going to mention over here. Like we are having angiotensinogen, which is converted into angiotensin 1 by the enzyme renin. Then angiotensin 1 is converted into angiotensin 2 by the enzyme of ACE, angiotensin converting enzyme. Then angiotensin 2, with the help of adrenal gland, it converted into the angiotensin 3. So angiotensinogen, about the detail of the angiotensinogen, is synthesized by the liver, which is then taken up by the bloodstream. So whenever the blood pressure falls down or drop below the level of the normal levels, so angiotensinogen, which is synthesized by the liver, is transferred to the bloodstream, and this angiotensinogen is flowing throughout the bloodstream and reaches ultimately to other bodily organ, like we are having lungs and the kidneys. In the bloodstream, the enzyme renin, which is produced by the kidneys, is responsible for conversion of angiotensinogen into angiotensin 1. This angiotensin 1 has no as such pharmacological action, physiological action, but it is considered to be the precursor of the angiotensin 2. So angiotensin 1, when reaches to the lungs, there is an enzyme known as ACE, which is then converted into angiotensin 2, which is a potent vasoconstrictor and which causes sodium retention. So this angiotensin 2 further taken up by the angiotensin 3, which causes aldosterone secretion. On other hand, there is another pathway which is governed by the ACE angiotensin converting enzyme, that is known as kallikrein kinin system. So on the other hand, kininogen is a protein which is taken up by the kallikrein and converted into the bradykinin. So upon bradykinin, ACE act and it converts into the inactive metabolite. So metabolism of the bradykinin takes place in the lungs as well with the presence of the enzyme. So what bradykinin actually does, normally it causes prostaglandin synthesis. This prostaglandin synthesis is responsible for vasodilation. This vasodilation causes decreased peripheral vascular resistance, thereby decreasing the blood pressure. So this is the normal process which is taken up if the bradykinin remains, but ACE metabolizes this bradykinin, so there is no decrease in blood pressure by the release of the nitric oxide. I hope this makes sense. So this is an important point. So what ACE do, it converts the bradykinin to inactive metabolites, so there is no vasodilation and there is no decrease in the blood pressure. This was the normal blood pressure, this was the normal mechanisms by which ACE works. So now when angiotensin converting enzyme inhibitors class of the drug is given or administered, what this drug or the group of the drug do is, it has, like we are having two mechanisms as I discussed earlier. So it primarily inhibits the enzyme ACE. It causes the blockage of ACE by two pathways, and the second one is the bradykinin system, bradykinin pathway. So there will be no metabolism of the bradykinin takes place with the angiotensin converting enzyme inhibitors. So the first one is, as discussed earlier, I am writing again. So angiotensinogen, with the presence of the renin, it's converted into angiotensin 1. This angiotensin 1, with the presence of the catalyzing enzyme ACE, is converted into angiotensin 2. So this angiotensin 2 is responsible for vasoconstriction. This is the important point which you have to remember. This vasoconstriction causes increased peripheral vascular resistance. So increased peripheral vascular resistance always causes increased blood pressure. On other hand, it causes aldosterone secretion, which causes aldosterone secretion leads to increased sodium and water level or retention inside the body. So these two ultimately leads to increased blood pressure. This is the normal process by which ACE works. So when angiotensin converting enzyme inhibitors are the drug class or the pharmacological class such that captopril is given, it blocks ACE, so it inhibits the ACE. So when there is a blockade of the ACE, so there is no conversion of angiotensin 1 into angiotensin 2, and if there is no angiotensin 2, so there will be no vasoconstriction, no aldosterone secretion. So ultimately the net result is decreased blood pressure. I hope this makes sense. Okay, this was the first mechanism. On other hand, we are having second mechanism, that was on the bradykinin metabolism. So it is known as kininogen. The protein which is taken up by the enzyme kallikrein is converted into bradykinin, and bradykinin is, upon bradykinin, ACE works and it causes inactive metabolites. So bradykinin, inactive metabolites. So we are having two main mediators over here. So normally metabolism of bradykinin takes place and there will be no decrease in the blood pressure. So in increased blood pressure, we need this bradykinin to remain inside the body, so vasodilation should take place. So when ACE inhibitors are given, it causes when ACE inhibitors are given, it causes blockade of the enzyme ACE, so there will be no conversion of the bradykinin into inactive metabolites and bradykinin remains, so this will lead to decrease in the blood pressure according to the vasodilation process. I hope this makes sense. So remember this vasodilation which causes decreased blood pressure. So in a nutshell, what ACE inhibitors do, it works on the two pathways. First one is inhibitory action of renin-angiotensin system, which is known as RAS, and second is stimulating action of the kallikrein-kinin system, which I have already mentioned. The pharmacokinetic properties are associated with ACE inhibitors, like we are having captopril. It has 6 to 12 hour duration, so 2 to 3 times can be given, and all other ACE inhibitors have duration of action of 12 to 24 hours, so can be given once daily. Next is the indication of ACE inhibitors. It is given in hypertension, congestive heart failure, and after myocardial infarction. The important point to consider over here is consider the dry side effects of the ACE inhibitors are dry cough, hyperkalemia, hypotension, and angioedema. So dry cough, it is associated because of increased bradykinin. It is thought to be accumulate into the respiratory trails of the lungs, so it causes dry cough. Then we are having hyperkalemia because of the decreased aldosterone secretions. And then we have hypotension. This hypotension is associated with lower level of the angiotensin 2, and angiotensin 2 is about that is potent vasoconstrictor. And angioedema, this is because of the leaky blood vessels. Comes with the bradykinin, which causes vasodilation, and vasodilation because of the nitric oxide, so it leads to leaky blood vessels, which causes angioedema. So I hope this makes sense. This is all about ACE inhibitors. Thank you for watching this video. Keep subscribing me, and comments or